Hi, everybody. My name is Kylie Casper. I'm an occupational therapy student from Creighton University, and I'm going to be talking about chronic tone and management. So the objectives for this presentation are to understand the difference between tone and spasticity, identify newly learned methods of managing chronic tone, identify newly learned ways to continue to promote neuroplasticity, and to be able to identify resources available to aid in understanding and management of tone. So to first start out with, where we're going to talk about what is tone. So tone is essentially our muscles' resistance to passive movement and stretch. So we all have a level of tone, whether that be what's considered normal or abnormal level. And it's important to understand that this is different than spasticity. So tone is kind of like a standalone umbrella term. And we will get into the differences between what is just tone versus spasticity. But it's important to understand that abnormal tone can be present with or without spasticity. And a big difference to note between tone and spasticity is that it's not dependent on the speed of the movement. So you can have a level of abnormal tone, whether that be hypertonia or hypotonia, so too much or too little of tone. And how fast you move your muscles doesn't affect that. And that will kind of make more sense here in a second when we get into spasticity. But yeah, so what is spasticity? So spasticity is essentially a combination of hypertonicity, so too much tone, so our muscles are too resistant to movement and stretch, and then also a combination of the reflexes in our muscles that are telling them to turn on or off. Those are too active. So too much tone, so too much resistance to stretch, and too much reflexes, so too much being turned on. And so an easy way to think of it is just kind of increased resistance to sudden or passive movement, and spasticity is dependent on the speed of the movement. So like I just specified with tone, tone does not change with speed of movement, but spasticity does. So what that means is that if you do have spasticity, if you try to move your muscles in a quick, just a quick manner, your body's going to fight back and your muscles and your spasticity is going to kick on even more. So if you do have spasticity, it's super, super important to move in a very, very slow, controlled manner to give your body a chance to kind of understand what's happening so that you're not fighting against yourself more than you already are. So an easy way that I like to kind of describe spasticity to people is that you kind of have to think of it like a disconnect between your brain and the muscle, like a short circuit. And then a bad connection between the brain and the muscle means that the muscle is going to react to any other type of input that it receives because it's not being told what to do by the brain. So some statistics on spasticity, according to the American Stroke Association, approximately 25 to 43% of survivors will experience spasticity in their first year post-stroke, but it can occur much later in recovery and in varying degrees of severity. And it is more common with hemorrhagic versus ischemic strokes. But again, it can occur with any type of neurological injury. So whether that be a stroke, whether that be spinal cord, it just kind of depends what's going on. So this is just kind of a visual to help hopefully make it a little bit easier to understand what's going on when you have spasticity and what's happening in your body. A lot of people that I talk to after having a stroke, if they do have spasticity, it's kind of become just like a term that's been thrown out to them and they know they're living with it, but it's really hard to understand what's actually going on in the body and how you can actually work to fix it. So really hope after this presentation, you have a much better understanding of really what's going on in the body and the things that are impacting it and the things that can help promote regaining of normal muscle tone. So this picture on the left, our healthy brain is in constant communication with our muscles. So our brain is kind of our master center. It's telling our muscles what to do. And then after a stroke, communication is lost. So the muscles aren't being told what to do at all. So they become what's called flaccid. And that's kind of too low of muscle tone. So not enough resistance to movement and stretch. So they become kind of loosey-goosey is like how I like to word it to people. They're just pretty much turned off too much. So then The muscle will start to act out on its own without the brain, and that's where we kind of get spasticity. So the brain's not telling the muscles what to do, and the muscles need something to be telling it what to do. They need to be controlled because our muscles don't have a mind of their own, and so they kind of just go haywire. They get their input like from the spinal cord. Obviously, our spinal cord isn't able to regulate things like our brain is, and so things just go a little bit haywire because there's nothing truly regulating our muscles in the way that they need to be regulated. And then this picture on the right just shows that the muscle needs communication with the brain. So kind of like what I just reiterated. So how does spasticity impact you? So spasticity, as you know, if you're living with it, can impact all areas of function, whether that be your ADLs, your activities of daily living. So anything that you do throughout the day to take care of yourself, your daily routine can make coordination very difficult. It can impact your walking. And it's important to understand that having spasticity on a side of your body isn't limited to just your arm or your leg. You can have it from the top of your head to the tips of your toes. It can affect the entire side of your body. And with that, you can get what's called, you can potentially get what's called contractures. And I want to take a minute to really hit on this because it's really important if you are living with any type of spasticity to understand what a contracture is, how it can possibly occur, and more importantly, what to do to prevent it. So, when someone has spasticity, it typically affects our muscles that are what are called our flexor muscles. So, everything that kind of bends our muscles. So, think of that like your pec muscles that help turn your arm in, your bicep muscles that bends your elbow, your forearm flexors that help bend your wrist, and then they also help bend your fingers. And I apologize if there's any background noise. So those muscle groups are bigger than and stronger than the ones that help open up everything. So like your triceps, your external rotators on your shoulder, and then your wrist extensors and your finger extensors. So what can happen when you have spasticity is that everything kind of flexes and curls up. And so a lot of times you'll see people holding their arm kind of towards their chest in a bent position, or maybe if it's in your lower extremity, you get like a foot drop where your calf muscles are kind of overpowering the ones that pick up your toes and pulls your foot down. I mean, there's just a variety, but what can happen is that if you are in that position for a prolonged period of time, everything in there kind of gets shortened up because essentially you're not using the full length of the muscle and tendon and things like that. So your body's kind of just like, well, we have all this extra length and I haven't used it in a long time, so don't need it. So things just kind of start to shorten up. And that's when you get a contracture. So it's basically when your muscles and everything contract and shorten. And then you are host then to a variety of other difficulties. So if that happens, you essentially have to work to again re-lengthen everything. That can be really painful, that can be difficult, it can be very uncomfortable. It could eventually lead to possibly needing a tendon release, and we'll get into that in a little bit. But so it is super, super, super important if you have spasticity to make sure that you are performing your range of motion at least 1 to 3 times a day, every single day, as well and as much as you possibly can, because what that's going to do is help stretch everything out and help keep the range and the length that you currently have and prevent it from getting shorter. And then along with that, you can get possibly some joint deformities. So when it comes to our joints, there's a phrase called motion is lotion, and that just means it's super good for our joints to be moving, and it helps keep fluid moving, and it keeps everything nice and loose and lubricated and things like that. It's just our bodies are made to be moving. And so when you have spasticity and you might be stuck in a certain position, your joints aren't moving like they're used to moving, and that can lead to potential deformities. So just another reason to be trying to move and stretch and range as much as you possibly can within your comfort and all that. And then I just want you to take a minute to think of what other areas that are on here that you might experience some difficulty or some impact due to spasticity. So, in order to help manage spasticity, it's important to understand what types of things can increase spasticity. So, basically, just any type of improper stimulus is a good way to think about it. So, any type of incorrect stretching. And so, this is where that speed of the movement comes in that we talked about a little bit earlier. So, if you have spasticity, it is very, very important to make sure that you are stretching in a slow, controlled, relaxed manner because like I said earlier, the quicker that you try to move spastic muscles, the more they're going to kick on and then you're going to be fighting against yourself. If you're having any type of emotions like anger, stress, anxiety, those can all impact your body and can increase your spasticity. So again, make sure that when you are going to do your range of motion and you're stretching, that you're in a calm, relaxed, comfortable state. You're in a calm and relaxing environment, and it's just something that's going to be conducive to what you're trying to achieve. Anything like loud noises or something that causes like a jump scare can cause your spasticity to increase. Fatigue can cause your spasticity to increase, and then temperature changes. So, like during the winter when it's cold, that can cause your spasticity to increase. A lot of people will notice, like when you take a shower, when you get out of the shower and it's a quick, sudden increase, or in and out of the bath, anything like that can cause your spasticity to increase. So just keep that in mind. Maybe don't try to do your ranging and your stretching right after you come in from a cold day. Give your body a chance to kind of acclimate to the environment that you're in. So now we will get into ways to manage tone in a chronic standpoint. And these are all things that can be used at any point of your recovery. It doesn't necessarily have to be when you're in a chronic standpoint. A lot of these things are things that you have probably heard when you were in therapy, but they are really important to continue to reiterate as you continue on throughout your recovery continuum. So the first thing is slow, controlled stretching to prevent those contractures, that shortening in wide ranges of motion, moving as much as you possibly can. So, if you have questions on what type of stretching you should be doing, what that should look like, how you should be doing it, I would encourage you to contact your physician, or if you are in therapy, contacting your physical or occupational therapist, and then they can prescribe to you a specific stretching regimen that's going to accommodate for your individual needs. But just in general, just stretching as much as you can. Stretching should be done 2 to 3 times a day, maybe even more if you're able, but at least 2 to 3 times a day. I like to tell people to hold your stretch 15, 20, 30 seconds, whatever you can tolerate. And it's super, super, super important to remember also that your stretching should not cause any pain. It shouldn't be uncomfortable. It should just feel like a stretch. If it hurts, don't do it. I know a lot of people hear that no pain, no gain, but in therapy, that is not always the case, and especially not with this. And the next point is proper positioning to protect the arm and the shoulder and to prevent aggravation. So, what that means is making sure that if you have any tightness in your arm, whenever you're sitting, sleeping, anything like that, to make sure your arm is properly supported, and more so to try to encourage yourself to position your arm away from your body and in an open posture versus allowing that natural position of kind of holding it in your towards your chest or towards your body if you do have spasticity. So just really trying to keep everything lengthened and opened. And then also if you have a shoulder subluxation, which is when your arm, the top of your arm, the ball of your shoulder kind of separates from the joint, making sure that you're supporting it and never letting your arm just dangle. If you're sitting in a recliner or at a chair, making sure your arm is properly propped up. And so just supporting it the best you can. The next point, strengthening opposite muscle groups. So, like I said earlier, those muscles that tend to get spastic are the ones that bend and flex everything. So, with whatever amount of voluntary movement you have, working to strengthen those opposite muscles. So, all the muscles that help open up everything. One way you can do that is through weight bearing. Weight bearing helps to strengthen weak muscles and turn off spastic ones. And it's also super great for joint integrity, bone density, proprioceptive feedback to your brain. So, what that essentially means is that when you're performing weight bearing, your body is giving way more input to your brain about what it's feeling, where it's at, what's going on. And that just gives your brain another chance to connect with your body. Um, what weight bearing can look like, if you're able to get on your hands and knees, it can be just simply being on your hands and knees and giving your arms a chance to put weight through them. It can also function as a stretch to your hand and wrist. You can weight bear standing at a counter or at a table, by laying your hand flat on the table as much as you're able to and just leaning forward through your hand. You can do it sitting down at a chair. You can kind of spread your legs apart a little bit, put your hand between your legs and lean forward through the chair, obviously in a safe manner. You can do it on the side of your chair. You can bring in a chair beside you while you're sitting and weight bear down onto your elbow. The possibilities are kind of endless, and there's really a lot of ways to modify and adapt it. But weight bearing is just super, super great. Um, yeah, medical interventions we are going to talk about now. So, some common medical interventions that you may have heard of, or may have had done, or may have be discussing with your doctor things to do in the future include baclofen and Botox, and these are medications. And so, Botox is an injection that goes straight into spastic muscles, and essentially what it does, it just kind of tells those muscles to turn off a little bit. Typically, Botox is given every 3 months. Or on the other hand, you can receive baclofen, and baclofen you can have with Botox at the same time, or you may just have one or the other. It just depends on you and your doctor's decision. But baclofen can be taken as a pill. It can be given in like a liquid form through a pump. It just depends on your needs, but that's just kind of another medication used to relax those overactive muscles. There's other type of muscle relaxers. We're going to skip tendon release for now and hop back to that. And then we're going to jump down to neurologically focused physical and or occupational therapy. They can work with you to give you an individualized and specific plan of care to help meet your needs. And along with that might come bracing, casting, splinting. What those are just essentially braces or splints that you might wear to help hold your arm or your hand in a specific position to help give it a little bit longer, lower load stretch and prevent contractures. Or you might have like a brace for your foot, just depends on your needs. And then a tendon release is more so further down the line if you have a contracture and your doctor feels that's the next best move. What they'll do is they'll go in and they will release the tendon. They'll kind of clip the tendon to help allow for things to lengthen back up. And then if you have any questions about any of these, I'm going to encourage you to talk with your doctor regarding any of these treatments. So, how can we still continue to encourage neuroplasticity? So, what is neuroplasticity? Some of you may or may not have heard this term, but essentially, what neuroplasticity is our brain's ability to continue to change and continue to grow. Neuroplasticity is at a really high point when we are really young and growing, but it's also at a really high point after we have any type of injury. And so here is where you'll probably hear people say that the most stroke recovery occurs within a year after a stroke or 6 months after a stroke. That's because those are kind of areas of time where neuroplasticity is the highest after an injury. But I don't want you to be discouraged when you hear that, because recovery does not stop after a year. There's people that I see that are 10 years out of their stroke and they're still making gains in recovery because of neuroplasticity. So is neuroplasticity highest right after an injury? Yes. But does it completely stop 5, 10 years down the line? No. And the beautiful thing is that there are ways that we can continue to encourage neuroplasticity even after having a point of injury, encouraging it without an injury in different ways. So the biggest thing, or one of the bigger things, is exercise. And what exercise does is it releases a chemical in our brain called BDNF, brain derived neurotrophic factor. Don't expect you to remember that because it is a lot of words. But essentially, what BDNF is responsible for is encouraging that neuroplasticity, so helping our brain to rewire itself and rebuild new connections. And so, like I just said, exercise is one way that we can encourage release of that chemical. Being in a cognitively challenging and a socialized environment, performing any type of like strengthening activities that kind of goes along with exercise. Performing activities that are motivating and enjoyable. Motivation really has a lot bigger of impact on our brain's engagement than we always sometimes don't always realize. Encouraging use of your affected side as much as possible, or those are all ways you can encourage neuroplasticity. And if that sounds familiar to any of you, the American Stroke Foundation encourages all of these things. So all of these things are happening every single day at programming at ASF. And so it's a really great program. But also to circle back on a couple of these points. So weight bearing kind of goes in with strengthening activities, but I know I emphasized a lot earlier on stretching, and while stretching is very important for a host of reasons, it's important to understand that stretching is not what is going to fix spasticity. Stretching is more so truly to keep range of motion and prevent contractures. The way to aid in spasticity recovery is to get the brain and the body back online together. So anything that we can do to help encourage that brain body connection is what is going to work towards recovering normal muscle tone and reducing spasticity. So one way to do that is weight bearing. And like I said earlier, weight bearing gives a lot of proprioceptive input to our body. So a lot of feedback from our body to our brain when we're putting weight through those body parts. Using your affected side as much as you possibly can. Using it alone is giving your brain a lot of feedback, but also encouraging you whenever you are doing activities with your affected side, even if it's just little tiny movements, make sure you're watching yourself because the visual aspect of it gives your brain a whole nother form of input. And yeah, anything like that. Those are all really great things. So, resources available to you. If you have questions on more specific questions on spasticity, if you have any questions on what you should do moving forward, or just looking for more resources, you can consult with your team of healthcare providers. You can call 1-888-4-STROKE or visit thestrokeassociation.org to learn more about stroke or to find local support groups. You can sign up for the American Stroke Association's free Stroke Connection magazine for survivors and caregivers at strokeconnection.org. And then you can join the American Stroke Association support network at strokeassociation.org/support network. And of course, you can contact anyone from the American Stroke Foundation by visiting our Facebook page, which is the American Stroke Foundation, or via the website, which is www.americanstroke.org. And then here are the references. So I hope that this presentation was educational and helpful. I hoped that it helped you to kind of understand spasticity a little bit more and to really get a better grasp on what it is, because I think understanding it is so important to being able to work on moving forward with it. So again, if you have any questions, feel free to reach out to your team of medical providers, anyone from the Stroke Foundation, and I hope you have a great day. Thank you for watching.